I'm going to introduce our panel reactants. Let's see. Shannon Sanchez-Youngman is a graduate fellow in political science. Sonia Bettez, graduate fellow in sociology. Nina Wallerstein, senior fellow at the Center, professor of family and community medicine, champion of public health and CBPR, known by most of you. And Gabe Sanchez, who is a associate professor in political science and senior fellow also, or associate director of the center. And I'm Bill Wiese, senior fellow from the center. We've had today's presentations have in common, although in very different contexts, moving on the basis of evidence gathered in very different ways towards action, and explicit action, trying to address the issues common to this conference, including the structural determinants of health. So this is moving forward and moving action forward. So what we're going to do is each of our new panelists is going to have an opportunity to, through some trigger questions or comments, to engage the entire panel into discussion. We'll go around and do that, and then just open it up for the rest of the time. So, Shannon, you got it.
Okay. I just want to start by thanking our panelists today for having the courage to stand up and really talk about solutions to health inequities in the United States. I really appreciated that, and it's exciting to hear people thinking about creative new ways to work both within the system and maybe outside the system to promote change. So it's the end of a long couple of days, and I love to ponder. So I'm going to ask each of you to ponder a little bit. And I want you to think about, in light of the proposed solutions you've heard today from your colleagues, what are the limitations and challenges and barriers to your own approaches? So I'm asking you to engage in some auto-critique here. And also, what have you learned, if anything, from your colleagues here? Have their proposed solutions, their epistemologies, their disciplinary stances impacted your thinking at all? In other words, what are you taking home?
Because this is none of our first rodeos, it's not so much what we learn from one another, but how we are reminded by one another of things we've already known, but it's always useful to be reminded of. And so I think the one point particularly in that regard was a point that Aida made, but which is, I think, a challenge we all face throughout our careers, which is how we come to new problems, new situations, new communities with the received knowledge and conceptualization of all the projects we've done in the past and all the things we've thought about in the past, but as she said, not allow that to blind ourselves to the new, to unlearn as easily as we learn from each new situation. And that cuts across all disciplines. Different disciplines are differentially attentive to that, shall I say, and different scholars are differentially attentive to applying that in particular circumstances. But it is something we need constantly to be reminded of, that none of us go in with a blank slate to new situations, but to carry our knowledge lightly and flexibly and constructively into those new settings is, I think, something we can always be usefully reminded of. And that is very much true with the work I presented here. And I think when I was describing what Americans think about things, that is what they think when they're asked on surveys, and that carries all the concerns that Ninez raised. But it's equally important to recognize that what they think is what they think when they are asked as individuals, and what they think when they can mobilize as a community can be something quite different, something quite more dynamic and more flexible, and that's always worth remembering.
Well, from Ninez, I learned about the residential segregation. I mean, somehow, although I know that it exists, you know, but somehow I haven't been factoring in the social determinant of analysis and discussion. So that was refreshing for me to realize that I've been ignoring, because some of the information, and you were very clear providing the data, is, you know, somehow I wasn't really, sometimes selectively, when we look at data and we look at information, we have some preconceived notion about what's happening, and sometimes we may tend to, and that could be a criticism in terms of, and then sometimes you may ignore all the things that is so obvious, like for example, yesterday when we were talking about place matter, and someone was saying how, regardless of ethnicity, if you live in the same kind of environmental condition, you're going to have the same kind of health outcomes. And then I was thinking, the data that I have shows that the whites that live in those communities, they're the fewer, but their health status is as worse or even worse than some of the African American and Latino, and I've been ignoring that as a fact that I have to go back. So that's an a criticism for me, and that has helped me, it has stimulated my thinking. The other part is that although I keep saying that the PIs, principal, you know, investigators tend to have too much control, and I have to admit that I tend to also fall into that same effort of wanting to have control of the project. Although I know in my mind that they are doing well, but I'm like, somehow you don't trust them completely. And there may be some contradiction what I'm saying, but I remember in this last example that I gave, where one of our community partners had a subcontract to do the diabetes management and control, because she has a agency that works with community health workers, and we value the work of a community called Wiese. And so it was very normal, you know, to ask the Centro Juan Diego, that's their name, to allow us to train them on the management and control, so the community health worker will be an effective educator. And so their contract agreement, and I told when I work with the community, I really spell out everything that we want, because performance, and there are all kinds of stories, I could tell you about that someday. But so it was clearly stated. And then the criteria for recruitment. So they have the responsibility to recruit participants for the diabetes education in the community. The criteria, the main criteria was that they had to be people with diabetes. And obviously to be trained, educated, following the curriculum and all the protocol that we train everybody about. And we also have a community evaluator making sure that things were done by the book. But then I let myself go thinking that everything was in place. When we start getting the findings for that particular program, management, we found out that the data didn't come out to be significant. I mean, based on the pilot study that we did with other communities, and when we did the baseline study in terms of clinical outcomes, for example, and some behavior, we know that we're going to see changes in the A1C immediately when you help people in the management and control, et cetera, et cetera. You're going to see that particular indicator. When the finding didn't come out, I said there's something wrong. And so I talked to the community evaluator, and he said, no, everything, we follow everything you said. And I said, well, let's have a meeting with a community partner. And obviously, when you work with a community partner, you acknowledge all their effort, because they really work very hard for their work in the project. And so in a dialogue with them and with the community health worker, what happened was that they did not include people all of them were diabetic, diagnosed with diabetes. So if they're not diagnosed with diabetes, that means that the A1C in terms of the outcome is not going to be impacted, because they were not diabetic to begin with. So obviously, so you have to then take a deep breath, tell and say, you did the right thing. One of the things, because she said, remember, Aida, we're not in research, we're not in academia. We're here to serve the people. And when everybody left this program and the word went out, everybody wanted to be in the program. And therefore, people who were not diabetic wanted to be there. How can I reject them? And that so then I realized that they're right. They're not a researcher, I'm the researcher, and they are there to provide services. So they felt very good that we're providing services. So what we learned from that experience was that actually the data wasn't really that bad. When we're still analyzing, we realized that people at risk for diabetes actually have very favorable, and the post-test have very favorable outcome, which means that this diabetes management and control can very well be adapted to people who are at risk for diabetes, and we could get some similar outcome in terms of behavioral changes and, and even hypertension. There were some other things that we found interesting. Actually, we published about that as well recently. So what I'm saying is that I am aware that I've been taught, because I've read the academia and the training as a researcher, that we need to be in control and make sure that we protect that data. And when we're working with the community, we realize that we are in that tension. How much can I really trust them that we follow the protocol? How much should I have to be overseeing every single step to make sure that that data get protected, because we know how important is that in terms of the finding. Anyway, I'm sorry, I keep talking too much.
Sonia?
Okay. I also want to echo Shannon in thanking everybody for being here. And I feel like we have a connection with Chicago now. We've heard a lot of people. Chicago is really a sister city. Thank you. One of the things that I want to do is invite everybody to do continue this self-reflection. And think about the things that we don't talk about. And the issues that we don't bring to the table. And why we do that. And one of them, I heard Dr. Lavis yesterday say, now I can say the word racism. And then from the historian, we learned that people were talking about racism from the very beginning when it started existing. So why is it that we constrict ourselves? The social determinants of inequity are also inequity not only in health, but in education, in justice, in environmental circumstances. And they're also the causes, so not just diabetes, not just obesity, not just cancer or hypertension, but they are the causes of all of them. And somehow, which happens at all levels in all countries across the planet, we do talk about social determinants, and then we end up focused again on individuals, individual responsibility, changing your behavior, learning how you cook better, learning how you eat better. So it seems to me that we kind of come full circle. So epistemologically, we may be thinking about this bigger frame, and then we get back to the bigger frame over and over again. So why do we do that? And I want us all to reflect on it. Like when you were talking this morning, it's really creative that we can go from, instead of using health as opposed to healthcare. You brought it back in his head to talk about healthcare. And at some point that became, again, very relationship. So why do we do that? And why do we continue to do it? And how can we change that without what we are all afraid of, right? That we're going to lose our jobs, that we're going to have a revolution that is going to cause a lot of blood and tears. So why don't we self-reflect on that? Why is it that we in that? And then you talk about solidarity, which is such a wonderful concept, and then you talk about solidarity through fear. And it made me really sad, because why don't we talk about solidarity through love, right? So what are those words and those concepts that we are so afraid to talk about?
All right, first on this one. So yeah, that was a great question. It really is a lovely question. And let me take a concrete embodiment of that. But first with just a bit of a caveat. It is certainly true that when I was describing the solidarity we could build from the commonality of bad experiences in healthcare, that indeed was driven from a set of anxieties or fears. But I think what I was reaching more for is the fact that once people would bring their problems to these consumer assistance programs, they would also be assisted. And so there would be a solidarity that comes with knowing there was someone there to be by your side as you encounter these fearful and scary things. Now, that begins the reconstruction of the positive in exactly the way you were describing, which is, I think, very important. And if I didn't convey that well, I hope that I can rectify that just a little here. But I think the deeper question, the question which I think you really well evoked here, is that the reason, the sad state that we are in, where we have to construct these consumer assistance programs to help people give voice to their bad experiences, is because we exist in a society where people's voice everywhere is systematically suppressed and ignored. Right? We live in a democracy where no one votes. We live in a democracy where no one thinks they can influence the political process. And so something like the consumer assistance program offers this faint ray of hope. They can actually get someone to listen to them about something that matters. But the pathetic thing we're not talking about is the fact we live in a society where that would be rare for people rather than the common norm. And that, I think, is a deep question that we need to confront much more directly.
But I know that when I was listening to you, a couple of things stuck in my mind that didn't let me to continue listening to the rest of your presentation. One of the things that you said was that people were not aware or knowledgeable of their health insurance. And then I said to myself, well, what I know, for example, in the context of Latino, they don't believe in insurance period, but it's home insurance or car insurance, and they don't understand those policies. So I was thinking that as a more generalized behavior, and it could be even culturally driven, we believe that insurance is a waste of money, put the money in a saving account. I mean, you talk to people, and they respond that way. The other thing that came to my mind was, what happens if I need assistance? Would I go there? What kind of assistance? If I'm getting a bill from a collecting agency that I haven't paid my, emergency room visit or whatever, do I want someone to just listen to me? I mean, would that do it? When in reality, you are under so much stress, and the stress and the fear and the threat is real, because someone could actually, affect your credit score or whatever. I mean, not the average person would not be worried. We would be worried about the credit score. But I mean, how could they be able to help financially if that could be?
Oh, that's what these programs do, right? They go to the insurance company, they overturn the bills, they seek alternative sources of financing for people. That's the job. That's why they're called consumer assistance. They're not, again, let me be very clear, they're not consumer listening programs. They have to listen to figure out what the problem is. But then their job is to go in and help people.
Okay, so that's the part that I missed. So the reason I missed that part, that there was some concrete financial assistance. Because you keep saying listening, and listening is a good thing.
And the listening is the crucial first step. In some ways, the listening builds that sense of connectedness. But yes, it activates something. That's the point.
I just get worried though that with a budget constraint that you top out at some point. So I think it's a concept that hopefully will play itself out enough that the government will, or states will invest in.
So if we talk about why do we have those budget constraints, I think that's one of the things we don't talk about, right? So I'd like you to reflect about what is it that caused the budget constraints?
We have a low tolerance for taxation in this country, unlike other countries that, it's 50-60% of their income. So we have a low tolerance for that. It's revenue financing. We have a budget constraint because we only raise so much revenue. It's not the budget constraint, it's the allocation of the dollars that we have. It's what's in question with the social determinants, the structural inequities question. I raised the budget constraint just because, again, I mean, just from experience in the fair land of California, is that every time we do have a budget constraint, it stops and so on. Like we had expansion of coverage before Massachusetts with these local initiatives of expanding, counties would expand coverage to kids or to healthy families, adults. But then once money ran out, then you stop with the ones who really need it. I mean, even in the survey that I run, we got federal funding stopped, money ran out. We stopped doing in-language surveys in Asian languages, which broke my heart. But so that's just kind of, it's, so that why are there budget constraints? One, we need to, you know, if it's government dollars, if you really believe governments have a role, I haven't talked about corporations yet, maybe that's your next question, but if it's a government role, then we're stuck with revenue financing.
Well, the other thing is now that there was a whole controversy in the last week or so about me running saying about 47% of the people depending on government sponsor and being powerless or whatever else is said about them. People don't, even if they have the opportunity to access the program, they don't want to be in that category or be, you know, stigmatized or whatever.
Did you find enough elephants? Or is there one?
Not yet, but I'm waiting for the audience.
Okay. Okay.
And I'm going to scrap my original question I was going to run with because it was kind of along the same lines. But I think as I'm sitting here reflecting, one thing that I look at the panel and I take a look at the invited guests that we brought out, what was interesting to me is there's no formal political scientists that we brought in, but all we're talking about is politics. Right? In terms of every discussion, that's what we're talking about is the political system, working within the constraints of the political environment and so forth. And so the question that I want to pose to try to leave us more on a positive note, right? So we think about ways to look to the future optimistically. It'd be easy to cast the question in a way where we'd say, working within this particular political climate or environment where we have a do-nothing Congress that can barely pass a budget, right? We've got the lowest approval ratings for Congress in American history. We've got divided government at all levels. I think it would be easy to cast the question that way. What I want to pose is the flip side of that that's more challenging, I think, is, you know, it's often said that with challenges come opportunities. Given that same political environment, what can you give us in terms of a positive standpoint of an opportunity that this political climate provides for positive change? And I'll drink from the own fountain here, and I'd say one thing that I've heard just recently, in a democracy where very few people vote, the upside is organizing the population could have real instant, immediate impact. Right? So a lot of us have talked about all politics being locally in the context of these discussions, right? Well, this city, on a good day at a local election, we might get a quarter of the population to turn out to vote. So mobilizing candidates that are favorable to our interests, right? Mobilizing the population to find these candidates is maybe easier, in my perception, than we often think that it is, given that particular, you know, point that you've made. So that's the question. Try to think optimistically. Terrible political climate, but it provides some opportunities, I think.
And actually, based on that sample that you gave, in our coalition that I was representing here, we have voting registration in our coalition meeting. I mean, I cannot say totally because those are federal funds, but the community wanted to have, you know, there were a couple of people who were registered to get people to register to vote. So we actually had an every meeting, you know, after the meeting, after the federal sponsor meeting, that kind of effort, it really paid off a lot and developed the consciousness and the whole fraction of people understanding how valuable is the vote.
I'm still thinking, sorry.
I'm a very optimistic person. I believe that things is going to change for the better. I agree with you wholly. The community mobilization and action is the best way to go. I just don't understand, and I guess, I don't know whether it was you or someone that posed a question, I think it was Bob, about why with this reception people are not angry and upset and in the street making noise. And that worries me to some degree.
Right.
I don't know.
I've done survey work on that, and they are angry. They are upset. But they are also so concerned with federal budget deficits and tax burdens in the future, particularly on future generations, they are very reticent to ask for anything more. Even if it's not for themselves, they're reticent to put any more burdens on government under a situation where they feel it is in a very fragile state. And that's very different than what the attitudes were like in the Great Depression.
But I think that we haven't done enough with our youth to be able to engage them in, consciousness raising. I mean, it's on me society. It's only, it doesn't impact me. I don't care about the neighbor. I don't care about it. I mean, why is it that we haven't been able to get our children and grandchildren to really follow many of the footsteps that we have continued on? There's something happening that people feel that they don't care, or they're not empowered to do so, or they feel they're not going to go anywhere if they try to make any noise, or there will be consequences that they're not ready to confront. Because even the activism that is occurring right now with the Affordable Care Act and many immigration reform, and you name it, most of the time, with few exceptions, are the older population that were part of that 1960 movement that are still in their 60 and 70 and 80 years old, advocating for the issues that they feel very passionate about.
Okay, I thought of something. I confess, Sonia, I am reductionist. I think a little tinkerer, and then maybe it has some big picture. So, like the research question, the snapshot of my results, that was tinkering, and then it could have a big picture. So actually, there are two things. One is I'm just amazed with my students, and that I have more students now that really want to go back to the communities. And part of it is because there's an economic slump, so they want to work in community-based organizations. And so they're bringing their talent, their ideas, their critical thinking back into the community. And it's some of the partnerships I have right now with community-based organizations. They were my students from 10 years ago who moved out to the leadership position. And so I think it's a better academic community partnership because of that training. So I think that they actually could make a better world. And the other is I'm glad that CMS will pay Medicaid providers close to Medicare.
Let me take up the mantle or the challenge of the political optimism. Though I warn you in advance, it's going to be optimism with a kind of dark edge to it. Just going to help myself. So, all right.
If that's the best I can get, I'll take it.
Exactly. So the good news is we're living with an administration which is not only supportive of federalism and state rights, but it's actually supportive of helping states get to constructed ends, unlike previous administrations that used state rights to abandon all responsibility for things. And so the Obama administration is really good at that. And moving forward, PPACA will be brought forward at 50 different state levels. Every state will be radically different from every other state. The administration is going to try to run blocking and interference to help them move forward. And I think in the best states, I would guess a dozen, 15, there's going to be real huge progress made on both the health care and some of the social determinants of health. Here's the dark edge. Supreme Court decision gutted the capacity of the federal government to bring up the laggards on Medicaid. And so we're going to see radical disconnection. The South, parts of the Midwest are going to, upper Midwest in particular, are going to break away. And we're going to live in a two-part nation in terms of health care. If you're in the lucky good part, it's going to be a lot better, potentially. If you're not, it's going to be a lot worse.
Thank you for that.
Dark optimism. Right?
Dark optimism. Nina.
So to continue the dialogue here, trying to build on the optimism, but also build from the self-reflection, reflexivity questions of Sonia and Shannon. I'm one to really encourage my own self-reflexivity around tensions and contradictions and challenges in my own work, as well as trying to force my students to do it all the time, as well as the teams that I work with and the partners in the community. And so it's kind of a mantra. But I'm very interested in what, when we're talking about equity and the re-equity possibilities or trying to bring these systems together, these different disciplines together, these different challenges, what it means to be a critical activist scholar. There's a tension of scholarship, do you just put the data together and, journals who don't even want you to talk about advocacy or anything that, you can't put the recommendations in, you just can put in the data, or that we can't, as private citizens, we can, of course, go testify to the legislature and do all that, but we're restricted in our own institutions at the Department of Health level, at the university level. The deans tell us where we can go and not go, and when we get invited, it's different. But so there's a lot of challenges to being an activist as an academic, and I just, in the role of trying to keep the optimism going, because I think people here in this room are very dedicated to trying to resolve these tensions. And there's a lot of tensions that have been talked about in the last couple of days, which I actually think will be, in terms of follow-up to this, wonderful to articulate as sets of tensions that then we can look at various levels of recommendations out of it. And I have a lot written down, but the scholarship versus advocacy is a big one. And a level of local, contextualized interventions and community-based participatory research versus national policies is another one. Universal versus targeted strategies. Setting-based versus kind of state-based. There's just individual behavior versus kind of social determinants as the targets. This whole couple days has been full of tensions and contradictions, which of course is wonderful. But so I'm hoping you can talk to any tension maybe, but I'm interested. I was trying to promote us to hear from you how you think of this goal I think everybody has here in the room of how to be a critical activist scholar.
Want to go first?
Well, I think it's a critical role to have. I never have experienced the tension personally, because I believe that it's part of my responsibility, not only as a citizen, but as a member of the academia. They have access to information through the research and data that not the average person may not have it. And we have a responsibility to share that information with the leadership, with those that are out there mobilizing constantly and trying to impact their community through, through policy or program or whatever they're doing. I remember before I had tenure that a community group next to where the University of Illinois was at said, there is a great concern because your university wants to close down the hospital at that time. And we have the right to stop that. And the people that are questioning said, and we want you to be our voice on this issue. And we are asking you to call this meeting with the president of the university and the vice president for health services is supposed to. And obviously, when I look at that, I didn't hesitate. I was very clear that I was going to do it because I said to myself, my first responsibility is to my community. And if they're right now feeling this threat of this hospital that will be closed, that would affect further the access to care, someone had to speak up. And at that time, no one was speaking up about it. So once we strategized about what exactly the meeting was going to be about and what was our recommendation, then I was the one on behalf of the group. The meeting was given to us. There were about 10 of us. And I say, I'm here, not as a member of the faculty. I'm here because I'm representing my community that has some legitimate concerns about your plan of closing the hospital. By no means you could do that without a community consultation, without an analysis and a strategy about how that particular movement and action would impact our communities, not only the Latino community, but the African American they certify your hospital. So there, and we demand this, and I don't know how many men, we have about 10 recommendations. And, everybody. When I get back to my office, my dean called me. Closed the door and I said, what's happening? He never talked to me, but anyway. He said, do you know that you don't have tenure? And I said, yes, I'm very much aware. Was that you that were in this meeting? I just got a word that you were engaged in this kind of behavior. And so, in a way, he wasn't critical of my behavior. What he was trying was to help me understand that I was in a system that all those kinds of behavior may not be considered acceptable, and that there may be consequences. Not necessarily from him personally, but when once the tenure and all that goes to a different level, there are other people that have that much control of it. And I thought about it, and I told him, thank you for your concern about me, and thank you for sharing those thoughts. But I need to sleep well at night. And I would not have been able to sleep well knowing that there was a need for the community to have a voice about this issue. And they have the confidence that I could be able to represent them and not be able to do that. So, going back to the original question, it depends on your own value system. It depends on what you feel is right for yourself. Maybe not everybody could do it, or may not need it, or the consequences are, too greater. But we have individual decisions that we have to make every day, whether it's about advocacy regarding academia and research, or whether it's another matter. But we need to be clear, because those kinds of experiences are going to be popping up constantly, and we need to be clear and centered about how we're going to respond. And it is an excellent question. When you read the research literature, there's this tension about whether you're supposed to be, as a researcher, objective, or whether you're contaminating, findings and even the data collection because of your own perception of how the world should be, and the solution to the problems you're studying.
So I'm going to preface my remarks by first, I think Mark should do a survey on this and have Aida help with the content and the question phrasing. Because I think it's a very important question, because I think the question is not, getting the prevalence of academics who see themselves as activist scholars, and then does activism scholarship lead to social change? Or is it overrated? I think that's sort of the... So that was the next step. Okay, so that's my preface. I think I struggle with that. I struggled with it through my career as an assistant professor before promotion. I was an activist before. I like to work with the same kinds of advocates that I worked with. And luckily, it's not just the individual, it's also what school you're in. I'm in a professional school, so there's some more leeway. It's not so much activism and scholarship, it's scholarship that has some impact. And so the activism part, the partnership with communities, helped me with the framing of the question so that it was meaningful, so that my policy really had an impact on those communities. But I always said in my statements that, the research approach is still going to be rigorous and objective, and I told the communities, I may find out that, FQHCs, you're paid way better than you should be paid. And I kind of give that caveat. But if you really believe for the health of the population is not so much, it's about how you're paid, that you really want this vulnerable, complex patient population to be taken care of, then we'll go ahead. But we may end up with an answer that it looks like you're overpaid versus you're underpaid. So I think that's kind of part of what's kept me on the even keel. I'm also, in my walk from north to south, I'm also part of women's studies. In women's studies, I took part in a symposium there too, and they really were so purist. They thought questions really should be like, from yourself, no contact with others. And so I think professional schools are different. So professional schools really do have to have some policy, some activism to
So I guess my response kind of builds on a strategy similar to Ninez. But my constituency is different. My constituency are state and federal agencies and policymakers. And so I spend a lot of time talking with them and meeting with them. And very few of the research questions that I come to don't emerge from out of conversations with them where they say, and I'll paraphrase in a nutshell, gosh, I really wish I had the answer to this, or I really wish we could go after that, but we can't, we're legally restricted from doing it, or I really wish this, that, and the other. And I say, oh, I can do that. And so in some ways, particularly for those of you most interested in policy, academics can become the action arm of policymakers and policy agencies in a very effective and powerful way. Now, to handle part of the tension that Ninez quite correctly highlights here, in many cases you have to go beyond that. You have to say, okay, this is what the policymaker wanted and needed. This is how the research can supply. All the CAP research I described to you grew out of exactly that. We went into Sociology, which is the federal office that's implementing the program. They're hamstrung. They don't know what's going on out there, but we can figure it out for them. But what you then have to do for academic trajectories, particularly in more traditional departments, but even in professional schools as well, you then have to say, okay, what's the core academic, conceptual, interesting question I can pull out of this that I can then bring back to the academic world? And by doing that, you're not kind of adulterating the initial effort. What you're actually doing is helping to inform academics of what really should matter to them. You're bringing back perspectives they otherwise don't get because they're locked in their own cloisters in exactly that way. And so you're really serving both roles very effectively. You just have to recognize, yes, the conscious task to do that.
Great discussion. What I'd like to do is open this up now. Unless there are any... So let's just open this up for a more general discussion.